Welcome to our exciting video presentation. Today we're diving into the insightful world of advanced parenting. Advice for helping kids through diagnoses, differences, and mental health challenges by Fradin. If you find our content valuable, don't forget to give us a thumbs up and subscribe for more engaging discussions. Now let's explore the wisdom and guidance this book has to offer. This slide introduces the chapter titled, Understanding Your Reaction to a Problem. The author shares a personal experience that illustrates the importance of parental intuition when it comes to recognizing developmental issues in children. The narrative emphasizes that while pediatricians provide valuable insights, parents often have a deeper understanding of their child's behavior and needs. The chapter encourages parents to trust their instincts and seek timely interventions, as waiting can lead to missed opportunities for support. Ultimately, self-awareness and recognizing one's strengths and weaknesses are highlighted as essential tools for effective parenting. In this slide, the chapter delves into the various strategies parents employ when facing challenges, likening it to packing for a vacation. The author explains that some parents prefer a light, flexible approach, while others may over-prepare, bringing everything they might need. This section encourages parents to reflect on their unique backgrounds and how these experiences influence their responses to challenges. The key takeaway is that understanding one's strengths and weaknesses can help in crafting effective strategies for supporting children. Ultimately, both approaches can lead to success, depending on the context and the challenges faced. In this slide, we explore the key themes of Chapter 2, titled What Matters Most. The chapter emphasizes the importance of understanding a child's perspective, especially during challenging times like illness. It highlights how prioritizing play can significantly aid a child's coping mechanisms. Additionally, the dynamics within a family play a crucial role in decision-making, as parents must balance their child's needs with those of the entire family. The Eisenhower matrix is introduced as a tool to help prioritize tasks, distinguishing between what is urgent and what is important. Lastly, it reminds us that children have their own priorities that deserve recognition and respect. This slide delves deeper into the balancing act families must perform when managing various priorities. It acknowledges that families often juggle multiple competing needs, where some are more urgent than others. The chapter warns against overlooking important non-urgent needs, which can lead to long-term consequences. Effective communication among family members is highlighted as a key factor in navigating these challenges. Each family member brings their unique perspective, which can sometimes lead to tension. Practicing mindfulness can aid in prioritizing effectively, ensuring that long-term goals are not neglected amidst the chaos of daily life. In this chapter, we explore the concept of medical and educational literacy, emphasizing how social determinants of health can significantly affect individual outcomes. The author highlights the importance of health literacy, which is often overlooked, and shares personal stories that illustrate the challenges parents face in navigating the healthcare system. These narratives reveal disparities in knowledge and support, showcasing how some parents are better equipped to advocate for their children than others. The chapter also discusses the complexities of the healthcare system, the importance of understanding referrals, and the need for effective communication and advocacy in securing the best care for children. Continuing from the previous discussion, this section delves deeper into the challenges faced by pediatricians who manage a high volume of patients, which can lead to time constraints and affect the quality of care provided. Families often express frustration with the healthcare system, feeling overwhelmed by the complexities involved. The chapter emphasizes the importance of understanding medication management and the role of specialists, highlighting the need for clear communication among all parties involved in a child's care. Additionally, it discusses the significance of early intervention and school support, urging parents to navigate the complex educational systems to ensure their children receive the necessary resources and assistance. In this section, we explore the challenges faced by Manuel, a child born prematurely with numerous health complications. His mother's emotional journey highlights the struggle of balancing care for a sick child while managing family dynamics, especially with a new pregnancy. The importance of maintaining a broader perspective amidst ongoing medical crises is emphasized. This perspective allows families to plan for the future, while ensuring that the child's health issues do not overshadow their lives. The mother's resilience and commitment to her family's long-term goals serve as a powerful reminder of the need to recognize the bigger picture. This section discusses the importance of identifying patterns in health challenges, as seen through the experiences of Manuel's family. Recognizing these patterns allows parents to anticipate future needs and respond more effectively. The narrative emphasizes the necessity of balancing immediate medical crises with long-term family goals. Advocacy plays a vital role in ensuring that children receive appropriate care. The concept of care mapping is introduced as a tool for families to visualize their child's health needs and the resources available to them, ultimately aiding in better management of complex situations. In this slide, we explore the story of Grayson, a child with severe food allergies, and the impact of his mother's research on his health. Grayson's mother felt guilt over the timing of allergen introduction, which led her to become proactive in researching food allergies. This research not only helped her understand the condition better, but also led to Grayson participating in a clinical trial for oral immunotherapy. The slide emphasizes the importance of parental research in navigating medical challenges, showcasing how informed parents can significantly improve their child's health outcomes. This slide continues the discussion on the importance of research in parenting, particularly when dealing with medical issues. It highlights how parents can ask their child's doctor the right questions to gain clarity and understanding. Additionally, connecting with other families can provide support and insights that are invaluable. However, the slide also warns about the potential pitfalls of social media and the need for critical thinking when evaluating online information. Ultimately, it stresses the importance of balance in research efforts, as excessive research can lead to anxiety rather than empowerment. Building a solid knowledge base is presented as a crucial skill for effective parenting. In this chapter, we explore the multifaceted challenges that parents face when navigating the healthcare and educational systems for their children. The author shares a personal story about seeking early intervention for her daughter, highlighting the administrative hurdles and emotional toll that come with caregiving. The chapter emphasizes that while many systems are designed to support families, the cumulative burden often goes unrecognized. It also discusses the unseen labor involved in parenting and how privilege can influence access to resources. Strategies for managing caregiving tasks, including communication and organization, are presented as essential tools for parents. This section of the chapter focuses on practical strategies that can help parents manage the complexities of caregiving. Time management is highlighted as a crucial skill, as parents often juggle multiple responsibilities. The chapter discusses the importance of open communication within the family to ensure equitable distribution of caregiving tasks. The teach-back method is introduced as a way to confirm understanding among caregivers, which is vital for effective care. Additionally, organizing medical information and tasks can streamline the caregiving process. The author encourages parents to delegate responsibilities and prioritize self-care, recognizing that caregivers also need support and time for themselves. In this chapter, we explore the significance of understanding family dynamics when caring for a child with challenges. The author emphasizes the importance of recognizing who is involved in the caregiving process and how their perspectives can influence the care plan. Effective communication is highlighted as a key strategy for involving family members, as well as understanding their strengths and limitations. The chapter also discusses the impact of caregiving on siblings, stressing the need to balance responsibilities among caregivers to ensure that all family members feel valued and supported. This section delves into practical strategies for collaborating with co-caregivers. The author emphasizes the importance of having a co-caregiver to share responsibilities, which can alleviate stress and improve the quality of care. Setting clear boundaries and expectations is crucial for maintaining balance and ensuring that all caregivers feel appreciated. Open communication is encouraged to address any emotional barriers that may prevent seeking help. The chapter also highlights the value of involving extended family and support networks, as well as fostering resilience in siblings, to create a supportive environment for the child facing challenges. In this introduction, we explore the key themes of Chapter 8, which focuses on the special considerations in parenting children at various developmental stages. The author shares personal experiences that highlight the unique challenges faced by children, particularly those with health issues. Understanding these stages is crucial for caregivers, as it allows them to provide appropriate support. The chapter emphasizes the importance of recognizing individual needs and adapting parenting strategies accordingly. By examining these themes, we can better navigate the complexities of parenting and foster a nurturing environment for our children. This slide delves into the various developmental stages of children and the corresponding parenting strategies that can be employed. Babies and toddlers are fully dependent on caregivers, making sleep and play essential for their growth. As children transition into preschool, they begin to demonstrate emerging capabilities, and effective communication becomes vital. The slide also highlights the increasing independence sought by 6 to 11-year-olds, as well as the autonomy demanded by tweens and teens. Throughout these stages, universal parenting tensions arise, such as setting limits and maintaining open communication, which are crucial for fostering healthy development. In this slide, we introduce the chapter titled Confronting Hard Feelings and Burnout. The story of Derek, a 10-year-old boy struggling in school, sets the stage for discussing the emotional challenges faced by families. Despite evaluations showing no specific learning disabilities, the family grapples with disappointment and the need for acceptance. Derek's mother experiences a range of emotions, including guilt and sadness, as she reflects on her own educational challenges. The importance of focusing on strengths rather than weaknesses is emphasized, along with the idea that challenges faced by children are not the fault of their parents. This sets a compassionate tone for the chapter. This slide delves deeper into the emotional landscape parents navigate when their children face challenges. It highlights the sadness and grief that arise from witnessing their children's hardships and the need to adjust expectations. The analogy of Welcome to Holland illustrates the unexpected journey many parents find themselves on. The complexity of grief is acknowledged, emphasizing that it is a natural response to lost dreams. Guilt is explored as a common feeling among parents, often leading to stress and burnout. The slide concludes with strategies for coping, underscoring the importance of self-care and seeking support to manage these difficult emotions effectively. In this slide, we introduce the chapter's focus on understanding a child's resistance to necessary medical treatments, using Emily's story as a case study. The challenges faced by parents in managing their child's health, particularly regarding medication adherence, are highlighted. It's important to recognize that resistance is not solely a parental issue, but often stems from the child's perspective and emotional state. By reframing the problem, caregivers can better understand the underlying causes of resistance, which can lead to more effective strategies for encouraging compliance. This sets the stage for deeper exploration in the following slides. This slide discusses various strategies for addressing a child's resistance to treatment. It emphasizes the importance of understanding whether expectations are developmentally appropriate and suggests using motivational interviewing as a technique to engage the child in meaningful dialogue. Listening to the child's feelings is crucial, as it can reveal underlying issues that contribute to resistance. Practical techniques, such as adjusting the timing and environment for treatment, can also make a significant difference. Collaboration with healthcare professionals is encouraged to develop tailored solutions, while being vigilant for signs of anxiety, burnout, or depression in the child is essential for their overall well-being. In this section, we explore Carlos's experience with asthma and the impact of restrictions on his life. His family, motivated by past trauma, imposed limits that hindered his physical activity. Despite Carlos's improved health, the transition back to normalcy was fraught with challenges. Families often feel unsupported during recovery, which can exacerbate feelings of anxiety and fear. The chapter emphasizes the importance of recognizing trauma's effects on both children and parents, highlighting that understanding these experiences is essential for healing and moving forward. This understanding can pave the way for a more supportive environment for recovery. This section discusses the symptoms of trauma that children may exhibit. In this slide, we introduce the key themes of Chapter 12, which emphasizes the necessity of a comprehensive plan for children facing various challenges. The author highlights that a good plan is not merely about medication or services. It must be tailored to the unique needs of the child and family. Understanding human nature is crucial, as it allows for the creation of buffers against potential errors. The author also points out common mistakes that can lead to plan failures, such as relying too heavily on one person or neglecting long-term goals. The importance of reassessing and strengthening your plan is also emphasized, encouraging readers to identify any weak spots early on. This slide outlines key strategies for creating an effective plan for children with challenges. The author stresses the importance of involving professionals for mental health assessments, as parents may not have the expertise to address all issues. Recognizing the need for external support is crucial, as it can provide additional perspectives and resources. Developing a solid emergency plan ensures safety, while ongoing supervision of care and medication is vital for maintaining health. Promoting social connections and encouraging resilience are essential for emotional well-being. Finally, anticipating future needs allows for proactive planning, ensuring that families are prepared for any changes that may arise. In this section, we explore the story of William, a young boy diagnosed with strabismus, which is an abnormal alignment of the eyes. His mother initially found success in motivating him to wear eye patches, but as time went on, his interest waned. This highlights the importance of maintaining motivation, especially in long-term therapies. The chapter emphasizes that challenges often come with ups and downs, and it is crucial to recognize this reality. We will also discuss various strategies to keep motivation high, distinguishing between intrinsic and extrinsic motivators, which can play a significant role in a child's engagement with their treatment. This section delves into practical strategies for maintaining motivation. First, we discuss maximizing intrinsic motivators, which are activities that are enjoyable and fulfilling. External motivators, like rewards, can also be effective, but should be used judiciously to avoid dependency. Taking thoughtful breaks is essential for both parents and children to recharge. Breaking down large tasks into manageable steps can alleviate feelings of overwhelm. Additionally, leaning on community support and reflecting on personal strengths can foster resilience. Finally, the chapter emphasizes that advocacy is a shared experience among parents, highlighting the importance of community in navigating challenges.